Well, let's jump right in. Thank you all so much for coming. It's a pleasure to be here and share more about insights over time and do research into how we can make global health and human rights more gender inclusive. But before we begin, I would like to share some trigger warnings. Right. So what we'll be talking about today, we'll start with some key terms in transgender identities and a little bit about the history of where we fit into society. And then we'll start talking about human rights and health, kind of interwoven, although the recommendations will be separate. We'll talk about how trans people are doing today, what they're entitled to, different drivers of poor health outcomes from the home level all the way up to headquarters of the World Health Organization. And then we'll do a quick case study on vaccines. We'll go through those recommendations, and also I'll be excited to share the results of the Transgender Day Visibility Survey, which complemented the beautiful art piece over there, and I have some questions for discussion. So I'd like to begin by distinguishing sex from gender. Sex is about what you are, what you're born with, your chromosomes, your body parts. The gender instead is who you are and where you fit in terms of different gender labels and norms. So most people are male or female and men or women, but also be born with different combinations and have different combinations of identities that will make these spectra. Gender expression is distinct from that as well. You'll notice, for example, that I am non-binary, but I have a very feminine gender expression, and so these can be very different. And finally, depending on the combination of these, you'll probably be treated very differently in society. You'll have different resources, maybe be discriminated against, and so on. So we can think of sex and gender in terms of like a coordinate plane. From on the y-axis, we have sex, so we can talk about what people's body parts are, and then we've got gender over here. And so you can imagine that intersex people might go over here and non-binary people in the middle. These different dots represent people because everyone has different combinations. And yeah, cis people, female women, cis men, male men, but then transgender people might be male women or female men. Yeah, please. Great question. If someone didn't hear it, the question was, if you don't identify as cis or trans, is that possible? And my answer would be yes. We end up somewhere in the gender non-conforming. You can be agender, you can be intergender, and not consider yourself trans. Trans is really an umbrella that some people choose to identify under. Yeah, and then a final note on pronouns. If you ever get confused, the question is what's the person's gender, not sex. So all of the orange dots are on the women's side. Many will take she, her pronouns. And then if you're a man, you'll take he, him, regardless of your sex. So how do trans people fit into our minds? Because we can only think within the bounds of language. So starting from here, you may recognize this from the flyer. These are different proposed and formally recognized gender neutral terms, but also like suffixes in 24 languages. In English, we have he, she, and they. So we do have gender neutral pronouns, but other languages don't have any gendered pronouns. I'm going to butcher this, but yeye in Swahili, for example, just refers to anything animal. So it could be an animal that you refer to. But in English, you don't have to gender yourself when you speak of yourself, but that's not true for other languages. In Thai, for example, even when you say hello formally, you might say sawadee ka if you're a man, and sawadee ka if you're a woman. And determiners as well. We're lucky in English that all the objects are gender neutral, but that's not the same. For example, in Romance languages, this is Italian. If you refer to masculine objects or feminine objects, you have to see the world and keep track of it through gender. And so that may affect the way all of these in which people think of gender and therefore transgender people. As for sociology, I love Judith Butler's argument that gender is a series of acts whose consistency creates the illusion of an underlying nature. So we perform gender for each other. You get a script about how to be a woman or a man, and trans people get the same ones and either don't want them or it's the wrong one. And so we threaten the performance that everyone works so hard to keep up. There are privileges to being trans depending on where you are. Two-spirit people, for example, among the indigenous peoples of North America, have the ability to work multiple jobs that are for men and women. And so sometimes they're the wealthiest people in their villages. In parts of Uganda and the DRC, Okulu and Agule people who are trans can really lead special religious ceremonies. And the Hijra people in India are a well-recognized third gender group. In other places, being trans comes with pressure. Structural violence is a helpful way of understanding how laws and policies can literally affect your body. So if, for example, there's a new law that says if you miss rent once, you have to get evicted, low-income people may be more likely to be evicted, and therefore their physical health is threatened by this new policy. Minority stress theory, zooming in a little bit more, talks about how there are unique manifestations of these pressures for sexual minorities, like if you're lesbian, gender minorities like us, racial, ethnic as well. And then zooming all the way into queer people, to trans people, we have gender dysphoria. This is a psychiatric diagnosis in the DSM-5, so it's considered a mental illness. I've got a huge asterisk just to say, I don't think it is. We have genders just like everyone else. But yeah, we have a lot of similar physical symptoms that are associated with structural violence. And so I would argue that dysphoria is just an umbrella term for how minority stress theory affects us in the same ways. So the causation's in the other way. And of course, there's a parallel in feminism because we have a huge group, much larger, more well-funded, longer standing fight for gender equity over there. So given that there are probably fewer than 2 million out trans people in the US alone, it's not easy to go up to a funder and say, we want to help these 6 people. So I'd like to make a brief case for intervention. First of all, we have no idea how many trans people there are. In many countries, it's criminal to be on the street and now perhaps even identify as trans. We're a hard to reach community. We hide, and there are all kinds of hate crimes. And it's also a question of self-discovery. If you had given me a survey 10 years ago and asked me if I was trans, I may have laughed. But I was also dealing with gender dysphoric symptoms and didn't have the language for it. So that is also going to contribute to our undercounts. And one of my favorite comparisons for how stigma affects over-reporting, under-reporting is left-handedness. Because back in the day, if you can see, this is like 1860 up to 2000, there was a lot more stigma around left-handedness. And we know that the global average is estimated to be 10%, but 4 times more people have started reporting since the stigma went away. And maybe the true global average is closer to 12. Thank you for coming. The curb cut effect, I think, is also a really good argument in favor of protecting the trans community's health and human rights. This refers to the Americans with Disabilities Act, I believe, where sidewalks were legally required to have cuts in them. So it's kind of like a ramp onto the street. You'll see them everywhere. And what was wonderful about that was not only did the people with wheelchairs benefit, but people with strollers and people who trip like me. So the curb cut effect is the idea that if you hit one minority community, may help many more. And so with gender inclusivity, which the trans community is fighting for, every gender gets the benefits. There's also an enormous amount of overlap between trans people and key populations or vulnerable populations, including sex workers, people living with HIV, low-income people, and sexual minorities like being gay and lesbian. In the US, for example, we know that the vast majority of trans people are not heterosexual, and many, this was 2020 to 2021 poverty rates among American trans people. Plenty of overlap. So again, with this curb cut effect, if you help trans people, the spillover effects, especially through word of mouth for health protective information, will be enormously helpful. And finally, with the curb cut effect, you have the wonderful benefit of cost effectiveness. So moving on to the bulk of the right to health, I do just want to at least refer to some of the major legislation around this. The UN defines human rights as rights inherent to all human beings, regardless of race, sex, nationality, ethnicity, language, religion. And then there's us, all other statuses. It would be nice to add gender to that list. And it includes, your right to life and a quality standard of living. Here are 3 of the big landmark treaties out of the UN. And I'd like to draw attention to one of the earliest treaties on gender equity, which was the Convention on the Elimination of All Forms of Discrimination Against Women. And you'll notice they frame discrimination as a binary that needs to be corrected for. There's kind of an implication that the end of discrimination will be when men and women are treated identically, something like this. It's about closing a gap rather than empowering everyone. And of course, a lot has changed, but the use of women and men in these human rights legislation has not. So trans people are not doing so well. Since 2008, they're reported, and so we know what that means, 4,400 hate crime murders. Even you'll notice in India, where the Hijra community is well respected and legally protected. And then just to zip through these awful things. And by the way, I'm sorry, all of these are active hyperlinks in the PDF that I'll send out after, and I encourage you to look into these because they're all peer-reviewed, et cetera. 46%, I'll just read them, of Lebanese trans people attempt suicide. 20% of trans Americans are unsheltered at some point. 68% of Venezuelan trans people do sex work, again, going into that intersectionality of discrimination. And 19% of trans women globally have HIV, and that's compared to a 0.5% global prevalence. Moving forward into discrimination and the importance of intersectionality, we already know that a lot of trans people face discrimination in healthcare settings, but when you disaggregate into trans people with disabilities, trans people of color, and gender nonconforming people, you'll see that the trends look very different. And the interventions, therefore, will also need to be different. And then odds and risks of alcohol abuse and intimate partner violence are very distressing. So moving on to those drivers from home to headquarters, these are all drivers of these poor health outcomes, but also barriers to progress. So I cannot emphasize enough that anticipated discrimination is a huge barrier to healthcare in the trans community. I believe between 1 in 5 and 1 in 4 trans Americans alone have admitted to foregoing or postponing healthcare in the last year because they anticipate discrimination. So we'll avoid care. As we know, a lot of trans people are low income and don't have insurance. That will prevent them from getting specialized care, maybe higher quality care, without understanding what gender is, what good health is and looks like, and what you can do in terms of health protective behaviors. You may rely on word of mouth for your health information. That's why I've got gossip up there, or other kinds of unverified information. I'll have a little case study on all of these. Just as an example, the claim that my child's too young to know they're trans. I was certainly too young to know I was trans when I was 20 years old. Like, this is not, an unfounded fear. But in the spirit of the curb cut effect and just getting everyone the words they need to understand what's going on, listen to your kid, right? Like, this isn't a complicated driver. And then finally, mobility restrictions are enormous, especially for women, cis women. For example, if you can't leave your home without a man, if you can't drive without a man, you will face violence if you do those things. This can create a very difficult dilemma for women and trans people alike, because how are you going to take your child to the clinic if your husband's working all day? It's a difficult decision. By the time you get to the clinic, if your providers are, God forbid, transphobic or any other kind of, a bias that would prevent them from giving you objective care based on gender alone, we risk re-traumatizing the people who show up and, of course, not coming back. The complex comorbidities like AIDS, but also, being on gender hormone therapy can cause side effects that people may not think of. And so we'll miss some diagnoses. Social and gender norms hurt everyone, thinking of, toxic masculinity here. And this can make it very complicated to get everyone the sex and gender specific care that they need. So I've got this example of witchcraft against birthing people in Uganda. There was one story of a woman who is afraid to get antenatal care, and so she hid her pregnancy for as long as she could, because there's a social and gender norm that if you're doing pretty well, someone will curse you. That's a shame in the new barrier. Gender providers can also be a difficult issue, because there was some program I remember that sent vaccinators to the homes of women with mobility restrictions, but they were not invited inside because it was, uncomfortable and could be dangerous. And so trans people, we can't find trans providers. It will also be unsettling and a potential deterrent. And finally, the refusal of care is abominable and constant, especially in low-income countries, and which leaves you with illness, generates shame, and could resurface some trauma. Now, looking at the government level, the number of countries that criminalize the LGBTQIA+ community, including trans people, I I think we're talking 63 countries total. But we also know that within loving the trans community and getting them everything they need, there's gradient. So you can see, right, that you need gender surgery to prove you're trans enough to get your passport changed. But going back, in the countries where there is capital punishment for being queer or trans, you make them decide in practice, choose between their lives and seeking healthcare. Aggregated data will always lead to aggregated interventions. And, as we saw with that, albeit, minor variation, until we disaggregate by both sex and gender, we can't develop really effective interventions for them. And the gender unaware policies, I have this for both international and national level work, and would be laughable if people didn't die. So we're thinking, for example, in Tanzania, they recognized that men weren't joining the birthing people in their antenatal care appointments, like their ultrasound screenings. And they also wanted to test them for HIV when they arrived. So what did they do? They said, everyone in Tanzania, make sure that, the women are bringing their men with them when they come for antenatal care. But they didn't give specific enough guidelines. And so the implementation ended up being really sexist. You end up with health providers denying services to women who can't bring their partners for any reason. And I mean, we can talk logistics, we can talk income and distance and sexuality. All of them could be denied care. And then the fast tracking of services to those couples, as opposed to the individuals who may need much more medical attention and support. There were reports of women sitting in the clinic all day because they couldn't bring their husband, and then the clinic closed and they couldn't get care. And this is one specific to sex workers in the Netherlands. This was a business owner who employed sex workers. He was complaining that the bureaucrats are busy making rules and they know nothing about the business. Here, there's a law that you have to have a pillow in the room of every sex worker, but you don't want a pillow in your room that's a murder weapon. Sex workers still get thrown out windows. Trans people still get smothered with pillows. Like, I get goosebumps at that. Just thinking you need community voices on this stuff. And then moving back up to the international level, there are political sensitivities. It's not very politically palatable to say we have trans people, they're not doing well and we need money. And so with that, I doubt radical progress will ever be made. And then the issue of reverse globalization should also be acknowledged, because this is a question of countries focusing on self-sufficiency and electing right-wing governments. As countries kind of close into themselves, it will be more difficult to, and sorry, the right word probably isn't enforcement, but spreading the infrastructure and knowledge system that you need is going to be more difficult as they wall off. And if you can't get into the country to ask trans people what they need, it's impossible to tailor it culturally. And jumping back to another embarrassing gender unaware policy, on the issue of HPV vaccines, this is an STD that 70% of global cervical cancers can be attributed to. So the HPV vaccine is basically a cancer vaccine, and it's rationed in lower and middle income countries only to girls and women, but it's supposed to be to people with cervixes who can be, saved from cancer. And so with, as of this morning, even they're still following this, it's all girls and women. And so with this, you will not only miss people with cervixes who don't want to go into a women's clinic or would be killed if they went into a women's clinic, like the stakes are enormous and it's hard to keep track sometimes, but you'll also end up vaccinating people without cervixes. And so that's a separate issue depending on your budget. So how does this actually play out in the lives of trans people? Here's our case study on COVID vaccines in India. When the government in July 2021 had claimed that 90% of the population of India was vaccinated, even if 10% were, only 5.2% of the Hijra community, right, the trans community in India, loosely, had been vaccinated. Why is that? These women on the right were profiled by Vice, and they gave us a nice little breakdown. Before you even get to the clinic, why aren't you getting vaccinated? They have literally no money left for survival. How can you pay for a bus ticket? How can you pay for a vaccine? The government that makes you pay for your own. There are also well-founded fears of taking the vaccine specific to the trans community. I don't know if anyone today can name a study in COVID-19 vaccines interactions with hormone therapies, AIDS or AIDS therapies, which trans women in India are 12 times more likely than the general population to get. So these are specific fears that no one has the money to address. Say they get to the clinic. They get in line, they're pushed into a different line, they're yelled at, all sex workers infected with HIV, one of them reported. You get to the reception, I think it was Imani who came and brought an ID that still had a picture of her when she was dressing as a man at the time. And so the government attendant was like, you don't match your ID. And so she later had to come back and dress up as a man. But I'm getting ahead of myself. And the vaccinators, of course, can refuse to vaccinate you. This has been reported a lot in India, and that people will not come back if they go through all of this indignity and still can't get it. So if you are willing and able to return, you may need to take drastic re-traumatizing actions to do so. And the shame and trauma, we cannot expect to go away. So here, I'm going to separate the opportunities for intervention for human rights from global health because they have very different systems of accountability. But there are some threads like decolonization that I'll come back to. So what can we do in law and policy? First thing we have to do is let them on the streets, make sure they're not getting murdered. Let's decriminalize not only gender identity and sexuality, but also jobs that we know trans people have, like sex work. We need more inclusive language. The WHO has to stop yelling girls and women. Yes, we need girls and women, but we need full gender inclusivity. And every time we say gender and mean women, trans people have fewer words to work with. There's an opportunity for movement building as well. If we can set up offices dedicated to gender inclusivity, there's a big movement right now in the international community about conducting gender analyses at every stage of your program design and implementation. Squeeze that in there. And there are laws about your legal, registered on paper gender that there have been wonderful laws for. Like Nepal lets you identify based on your self-feeling as of 2007. The colonization of global health and human rights is a sticky issue, and the term itself has been questioned a lot. But the idea that I'm hoping to refer to here is that systems over time have made it much easier for high-income countries to protect the health of their people and much harder for low-income countries. And so you have a hierarchy of resources, but also, value. The high-income countries will do the research and then, gift it. And then they'll extract data from those low-income countries to help them, right? So there are difficult dynamics in here that will make it much more difficult already for trans people to make change from the bottom up. So arguably within human rights, we see this with high-income countries debating what a right should be, regardless of price, and then the low-income countries end up implementing it. So that kind of divide will need to be worked on by people much smarter and more qualified than me. On the question of data and inclusive research, one of these scholars in the bottom right, these are all active hyperlinks to my sources that I encourage you to explore later, has noted that there's a kind of insider-outsider research staircase. And the insiders get to enjoy the staircase. They walk up, they learn new things, they're tying together. But the outsiders are ignored and then thrust to the top of the staircase without training everyone else in the team. And so the idea that we push people to the top of the staircase may be a remnant of colonialism because we want to just yell, look, we have community input. We found out yesterday, DevEx revealed that out of $75 million of UK and US foreign aid to Uganda since 2014 was redirected to anti-LGBTQIA+ groups. So the idea that high-income countries will gift all this money and then not see where it goes, I think is also an indicator of this hierarchy, and we need to open up dialogue. We know Museveni in Uganda right now has just sent back an awful homophobic bill, and transphobic bill, but in doing so referred to pressure from the imperialists to cut the bill. So maybe we're contributing both financially and ideologically to this entrenchment. In terms of accountability, these were a couple of points by Human Rights Watch that I loved. The first is that governments committing human rights abuses recognize that in the end, it's a public relations problem. And so we can make this a worse public relations problem. We can also make it more expensive to be transphobic, as strikes, protests, sanctions. And then there's definitely room for foreign assistance to make it easier for trans people to rally together. Even if they can't decriminalize, they can put money into peer networks, for example, community-led civil society organizations. Turning to health, there are some trans-specific interventions we'll need, but I hope that many of the takeaways today are that we just need to be integrated. There's all kinds of wonderful gender stuff we're watching going on. We want to be part of it. So in the spirit of full gender inclusivity, the title of this talk, I hope that going forward, as we fight for gender equity, we can explicitly refer to the trans community as well. There are discrimination laws and policies out there that can incorporate trans people, like that whole list that we saw from the Universal Declaration of Human Rights. Just add gender to that. Pulling decolonization over into health. We see this especially in health research. And we've watched in USAID, for example, dedicate 25% of their budget to localization. So this would be community-based organizations, but we don't know what that looks like, and we don't know which ones are getting it. And so if we can pull trans people into the staircase at a reasonable level and recognize that that research is as valid as anything in JAMA or the New England Journal of Medicine, I think it'll be much easier. And the WHO, in their recommendations on HIV, STIs, HPV, pulled in a lot of injection drug users, trans people. So this is a good example of a natural place to pull in trans voices when you're developing guidance. And it would be nice if we could join the feminist movement too, but that's a discussion for another time. And then specific, targeted interventions and opportunities for trans global health. We need policy seats at the table for issues that will impact us. Also because we know how to solve them better than the cis community, I would argue. We need more community outreach and peer networks with any hard to reach community. This is one of the best practices. You need them to talk to each other, find each other, because you won't. So we should be leveraging those. And then again, we need to just disaggregate our data by both sex and gender. It needs to be anonymized so we can get closeted trans people or secretly trans people to participate and share their insights. And then we also need to start paying attention to social factors. There's probably a price to the US not saying you can't fire anyone because of their gender identity. Just like there was probably a price to saying you can't fire people based on sexual orientation, except that's now in the laws that we are. So I wonder whether we should start looking at social determinants of health for trans people specifically. So I'm just going to move on, wrap up before going into the discussion questions and extra resources with the results of this survey we started on International Trans Day of Visibility on March 31st. So quickly about the survey, my goal was to create some kind of data set that students could play with and find correlations in, and that were generalizable to other data that we know about the US. So much of the wording was lifted from, in quotation marks, from a Pew Center survey. I advertised it in person, online. We kept it anonymous on purpose. We only wanted Columbia affiliation and then disaggregating by sex and gender. And of the 25 responses, we had them go through 10 different statements, factual statements, and agree, disagree, or admit they were undecided. So the 3 examples I've got up here, we had a 100% agreement on. Gender diversity should be taught in US middle schools. Not using people's preferred names and pronouns is insensitive. And there's a great deal, which is Pew Center, of discrimination against trans people in the US. And before revealing the results, I'd like to give my special thanks to Office of Student Affairs, Anya, Sandra, Professor Corellis, Sophia and Shreyas, and Eli Binder as well, who I believe is on Zoom. Just a breakdown of both the survey's sample and hopefully an illustration of the importance of disaggregating by both is the fact that, those are percentages because we had a 100% response rate, but when we didn't have a 100% response rate, like many people mark their gender but not their sex, I use the number of responses instead. So that's why it's 15 and not 15, 75%. So you'll notice 3/4 of our respondents were female, but less than half of them were women. what if we had only asked about this when there's all this, all the more gender diversity than might be clear from people's sex alone. So here are some of the statements that were mostly agreed to. Columbia seems to understand the difference between gender and sex. No trans people believe that we also belong to the feminist movement, but there's less certainty around whether they, them pronouns are grammatically correct. They are. And then finally, there was some confusion or disagreement around whether or not religion has anything to do with this. There were a couple outliers, and I want to note them partly because they may have been shortcomings of the survey itself. We had disagreement on society's treatment of trans people changing at an appropriate pace. One person, for example, said in their open-ended box on the survey that they said they disagreed because they wanted progress to be moving more quickly. So I probably should have clarified in a good way or a bad way. And then there was a question about what hometown means. But even given that, it certainly seems that we are much more liberal at Columbia and trans-inclusive than where we came from. So finally, just very loosely comparing to the US and generalizing, we seem to agree, as we saw before, that there's a great deal of discrimination. Americans do not seem to agree. The 57% includes both great deal and fair amount, mind you. They didn't disaggregate that in the Pew results. Society's treatment, America's a lot less happy with where this is going than we are. A lot less support for teaching in middle schools and high schools. This was a question asked to parents of both middle schoolers and high schoolers. And they said either it's good that their children were taught gender diversity or bad that they weren't. We're a lot more religious as a country on the whole and have no idea what's going on with the difference between gender and sex. At the end of the survey, there was an open-ended question. Can our communities of Columbia be more trans and gender inclusive? And if so, how? So I'll just give a minute to read through these excerpts. And I'd like to note that all of this data, in the spirit of sharing and students finding correlations with data software that will never make sense to me, I hope that this set of recommendations in the data set will also be useful for students, faculty, and affiliates at Columbia. And one more note, this is an excerpt from the most recent UN High Commissioner for Human Rights in a statement titled, "Human Rights Are Not a Luxury." And it reads, "First, one group of people is singled out for hatred. Next, it will be more, and then more, as the machine for exclusion accelerates into violence and into civil or international warfare, feeding always on its own rage, growing frenzy of grievance and blaming. What we are destroying is, quite simply, the structures that ensure our safety." And I'm sure we're all part of a group that can be singled out for hatred. Here are a few hyperlinks that I encourage you to explore later related to gender nonconforming literature and trans activism. And thank you all so much for coming. I have a few discussion questions I'd love to throw around, and we will stop the recording so that people's contributions can be anonymous.